Hi everyone, good evening and welcome to this second webinar in the Smart Nation in Conversation series. My name is Vernie Olivero and I'm Principal Researcher in Digital Government at the Civil Service College, and I'll be your moderator for this evening. The series is co-hosted by the Smart Nation and Digital Government Office and the People's Association. Tonight's webinar is titled Digital Government in the Time of COVID, Flattening the Curve Through Digital Solutions. Singapore's contact tracing capabilities have evolved dramatically since we first tackled SARS and MERS in the 2000s. And in today's fight against COVID-19, digital technology has been vital to contact tracers. Yet both here and around the world, it has not been without controversy, and there are tensions and trade-offs between very valid issues of privacy, data security, utility, accountability, among others. So tonight we have a great panel of experts from the health, government technology, and academic sectors to help us unpack these issues and understand them better. Speaking first will be Dr. Leong Hoe Nam, who is an Infectious Disease Specialist at Rophi Clinic, Mount Elizabeth Novena Hospital. Next, we will have Mr. Tan Chee Hau, who is Director of Planning and Prioritization at the Smart Nation and Digital Government Office. And our third panelist is Professor Ang Peng Hwa, who is a professor at the Wee Kim Wee School of Communications at NTU. I'd also like to take this opportunity to acknowledge some colleagues who are working behind the scenes to make this possible, specifically Amber Tan from the Smart Nation and Digital Government Office, who will be helping us with some housekeeping duties today, and my colleague Heng Kim Pern from the Civil Service College, who will be helping me to identify the questions that you're asking in the chat for tonight's webinar. So I'm going to start by asking each of our panelists to share some of their initial thoughts with us. So I'd like to start with Dr. Leong from the Rophi Clinic. He was previously a consultant in the Department of Infectious Diseases at SGH, and also previously had a practice at Raffles Hospital, and he should be no stranger at all to the Singapore public. Dr. Leong, please.
Hi, thank you everyone. I'm going to start sharing my slides now. That should come out quite nicely. I'm going to go to the question. Okay, sorry about this. Okay, good. We got a wonderful evening, and we're going to start off by talking about the Smart Nation in Conversation. And I'm going to show you some hard truths, a little bit about the virus, which we know quite a bit of now. Okay, what have we learned? This is actually taken from the news quite recently. Tamil Nadu, COVID-19 hits, they have a new high, and this is Hong Kong. We've heard so much about it from the incoming people returning back to Hong Kong. They're actually passing the virus on. And this is a very, very poignant picture. You see graves that are dark because many people are actually dying. And this is Brazil, just taken a few days ago. And it's not just Brazil, but North America, you see boxes, empty boxes, or in this case, it's actually occupied boxes of coffins because people are dying. And this is North America. And we have people trying to fight this mask thing as it has been politicized. I show this for all my talks on COVID-19, and every week it seems to increase by millions. But in the last few weeks, it's been increasing more than 1 million a week, and we're not seeing a drop in cases. What about this virus? This virus is about world domination. It's going to survive and insist on surviving. It will sacrifice 99.999% of the population just as long as one virus survives through. And guess what? It is mutating. You may have heard about the 614G mutation, and it's adapting so that the virus can infect better. And guess what? It will kill, it will mine anyone in its path, which is as long as it can achieve its goal, which is world domination. It is nothing personal because it will go on to hit every race, every language, every religion, and it's one united virus. But guess what? We are fighting in a rather disunited way. We think of it as Singapore, we think of it as a region. No, the world is very connected. If the world is not connected to fight this virus, if we are disunited, nationwide, worldwide, we are going to be in trouble and the virus will win. And I've heard this many times. They say it's unprecedented. I'm going to challenge you, or is it truly unprecedented? The answer is, of course not. It has been repeated, and this is history in the making again. You see this poster, obviously it came out in the yesteryears. It came from 1918 Spanish flu. If you look at the pictures now, this is taken some time ago from China. You actually have beds of people trying where to accommodate people with COVID-19. And look at the same picture taken during the Spanish flu in 1918. Beds in wide areas. They've had people wearing masks walking around, and certainly people wearing masks yesteryears. You have policemen wearing masks, and you have policemen in the past, in the Spanish influenza, that will wear masks. These masks were actually sewn by the Red Cross Society for the policemen of the era. Then you have crazy inventions or perhaps clever inventions, and you have the same thing happen as well. The deadliest plague of the 20th century, Spanish flu, 1918. This was taken obviously quite some time ago. And you have messages from World Health Organization: cover your mouth, cover your with mask, and things will be fine. And we have the same messages from the Red Cross: wear a mask and save your life. So coming back to this slide, is it unprecedented? Of course not. It is precedented. And the same message that we went through then, we can actually replace it with COVID-19. And then you might notice there's a slight change. It's to don't see your plant doctor, but see your doctor if you're not feeling quite well. All these messages about keeping away from sick people, it's distancing, handkerchief, cover your cough, avoid crowded, social distancing, is pretty much the same messages. If you think about it, why are our death rates better than the Spanish flu of 1918? I would then say thanks to the medical healthcare system, because of better healthcare system, we are actually having better survival. Otherwise, our numbers could match Spanish flu very easily. SARS-CoV-1, CoV-2 reflects the SARS coronavirus in 2003 versus the COVID-19 of 2019, which was reported on the last day of 2019. I'm going to go through some of the things about the virus, about this, their habits, and this will explain why SARS is actually a little bit different from COVID-19. In COVID-19, the virus is huge amounts of it at the very beginning of onset of illness, and it falls rapidly thereafter. And then, so what it means is that you can transmit very quickly, very well at the beginning of the infection. In fact, you can transmit even before the onset of symptoms. If you compare with SARS coronavirus 2003, the viral loads are low. It peaks up only at about after the 7th day of illness, and after that it falls, which means the transmission happens in the 2nd week of illness, which means if you have fever, you have respiratory symptoms, we lock you down, the virus is contained in that individual. SARS 2003 transmits late, which means we catch the patients early, we prevent the transmission. COVID-19, conversely, transmits very well early. You can't find the patient happily transmits, and this becomes a problem. And you heard about this, asymptomatic, pre-symptomatic transmitters. Singapore reported this in March 2020, where we talked about pre-symptomatic transmission occurred 1 to 3 days before the onset of symptoms. And this is actually from Washington, again, nursing facility. What I want to illustrate to you on this in this picture is that you have billions of viruses. If you are familiar with PCR, if you have a CT value of about 15 to 20, you have billions of virus in each sample that's taken even that you can be found in an individual before the onset of symptoms, which means the virus is very, very prepared for transmission very early in the disease. Now, if we apply SARS rules on this virus, we will fail miserably. Now, this is just a quick slide to show to you that if we can control the virus, can be controlled with the mask quite well and easily. COVID-19 is very successful. It spreads before the onset of symptoms, and it spreads by respiratory droplets. You don't even need to shake hands with the person. It preys on the weaknesses of human beings, and then human beings will transmit the virus cross miles simply through the airborne through the flights which we know of. Now, this is Singapore in the contact tracing, and you realize that these methods are actually very, very similar to what it was in 1918. The world has developed, medical care has improved, the viruses have evolved, but yet our contact tracing is still 1918 style. We are truly behind the curve. I'm just going to show you very quickly this slide that the virus is spread very easily between the different individuals before the contacts are identified because they develop symptoms late. The challenge then is to shorten the period between a positive test and tracing the contacts so as to improve the efficiency. And this is where the challenge of technology comes in. If you have a mobile app, you can effectively lower down the delay in testing, and then in turn, the plots will be much lesser. This is a graph to show you the reproduction number that's very high at 1.2 at the top. When you actually use a mobile app with better contact tracing and better delay, reduction in delay, you end up with a better result. Manual tracing results in us behind the curve. Mobile apps can actually help us. And this is just to show you, illustrate to you when you travel, etc. You're going to spread to many people. But once you identify the individual, you can have an instant signal. You can actually control the rest of the people and make things, makes the whole disease controlled much faster and quickly. The more we isolate and quarantine, the better the results. And all this, we have to be fast. We have to be better than 1918. Again, this is just another study to show you that the lesser delay there is between isolation and contact tracing, you actually have the curves, they are lower. That means we actually bring down the control of the virus better and more effectively. The final word is this: technology has advanced, even human culture has been changed. Medical care have evolved, and the viruses are constantly evolving. Yet our contact tracing method is what we're using now. And for many parts of the world, we are constantly behind the curve. Are we adapting sufficiently? And on the play on the word on smart nation, can our nation smart ourselves up? Can our nation smarten ourselves up? Okay, I'm going to pass the time off to Dr. Vernie, and we'll talk about questions later.
Thanks so much, Dr. Leong. I just wanted to thank you for giving us such great food for thought. A word to the audience: if you have questions for Dr. Leong stemming from his presentation, do pop your questions into the Q&A function in Zoom, and we'll pick them up later. I think your presentation, Dr. Leong, has given us, I think, a keen awareness of the importance of reducing the interval of time between possible exposure to the virus or onset of symptoms and entry into quarantine or hospitalization. So at this point, I want to ask the second panelist, Mr. Tan Chee Hau, to comment a little bit about the technology involved in contact tracing. He is a very experienced public servant who has served in numerous agencies, and he also has a background in computer science. So I think he's the best person for this task. Chee Hau, please.
Hi, good evening, everyone. Very happy to be here at this seminar with all of you. In better times, I will be in person talking, and I'll be able to actually see my fellow panelists, my very distinguished panelists. But today, you have to make do with this. I think we're all getting used to Zoom. Without further ado, let me perhaps share a bit more about the kind of digital tools that we're using for our COVID-19 response. I think the first point to make is COVID-19 is not just a public health crisis, but it's actually a national crisis. And the technology that we need is to support a comprehensive response across many different areas. Firstly, it's about communications. We do need to have timely, accurate information, whether it's WhatsApp or portals. I think the topic that many of the audience is here for and want to find out, accuracy and speed of contact tracing. But there's also other aspects of it. Safe distancing. How do we get the community to be prepared? Whether it's temperature scanners, understanding crowds, enforcement of quarantine orders. And even beyond sort of public health, there is social supports supporting businesses. So it's really, we need technology in a very comprehensive set of areas. But today I'll go into a bit more details about to trace together and safe entry, I think there's quite a bit of interest in this. I'll start first by explaining how the technology works, or how the products that we have introduced works. Trace together, the most important question it helps answer is to identify who was near you. Who have you been near? And so there are a few things. The first thing to note is when you are a trace together user, after you download the app and register, you actually assign a random ID. I just listed an example here. It's a very long string, it's completely gibberish, it changes at regular intervals, and the only party that knows, that can decipher it and identify who you are is MOH. The Trace Together app uses Bluetooth to detect as well as record the list of Trace Together users near you, but it records only the random string. So again, nobody knows who it is. The data stays on the phone and is deleted automatically after 25 days. But how is this going to be useful? So if, and only if, a person tests positive for COVID-19, MOH will request that the person upload a Trace Together data. You'll get a request through SMS, and then on the app, there's an upload function. And this provides a contact tracing team in very quick time, a list of possible close contacts. And with that, they're able also to identify perhaps close contacts that you might not know. So this really speeds up the contact tracing process, and it fills in some of the blind spots that human contact tracers may not know. For example, if you've been to a restaurant, actually it's going to be quite difficult to know who was near you at the next table. And MOH defines close contacts as those within 2 meters and have been seated for about 30 minutes. So certainly the neighboring patron would qualify or could qualify. A complementary tool is Safe Entry, but it actually serves a very different purpose from Trace Together. What it does is that it helps recall where you have been, as opposed to who you have been nearby. So quite different questions. What you do, I'm sure all of you are familiar because you have to do it many times, is to check in and check out premises, for example, restaurants, office buildings, sports facilities, gyms, and so on. The data collected is encrypted and is stored on secure government servers. Again, it's automatically deleted after 25 days when it's no longer needed for contact tracing. And if a person tests positive for COVID-19, the safe entry data is used to pre-fill activity maps. That's the map that contact tracers, when they conduct interviews, they fill up. And this can speed up the process significantly because it's all pre-filled with the list of places you have been checked in and checked out of. It's also more accurate than manual recall. It's often very difficult for us to remember where we have been, even like today, at the exact time, much less a couple of days ago. And it's not just about, when you think about contact tracing, many of us think only about issuance of quarantine, isolation. But actually from an investigative point of view, it's also very important to identify transmission chains, knowing like where people have been they all been to the same place, or there are certain infection clusters, and that allows MOH to take follow-up action. I'm going to sort of end off with this part of my presentation just to explain some of the principles that we think about when we develop some of these products, and we can happy to go into details later. The first is that technology is an enabler. It does not replace the human. Actually, contact tracing is a very skilled profession. It requires a lot of training, but what we can do is to speed up many of the manual processes. Secondly, technology only works if it's guided by public health requirements and the national strategy. So you must serve the authorities, but you must also serve the users in citizens and business, right? In Smart Nation, we believe very strongly that in user centricity, if you want people to use a technology, it must work for them. So we take a very citizen and business-centric point of view when we design the products. And fourthly, we can't do this alone. Government cannot stop COVID-19 alone. We have called Trace Together community-driven contact tracing, because it's something that we need to facilitate and empower the community to work with us. And in terms of how we design the tools, how we want it to be open, interoperable, that's also something that we want to work with the industry on. It's not something that government can do alone. And finally, Dr. Leong has said it very well, the virus is evolving. As someone who is not well-versed in this topic, it's actually quite scary to understand the mutations. And so similarly on the technology side, we must continually adapt and improve. I'm going to end off with one specific example on Trace Together to just illustrate how it is. I think to many people observing from the outside, it seems like it's very, very clear what's going on. But I can tell you sort of from the inside, we started the development prototyping in late January. We really didn't know very much at that time, very little information, but we had to act with the best possible that we had. By 20th March, we actually launched the app. Along the way, there was user feedback, so we tried to reduce the battery drain. We knew that some handset models were very actively killing the app, so as to save battery and memory. So we had to make changes. We had to add, like I mentioned, user-centric, really add more support for languages. We later on added the registration of NRIC so that we can more definitively know who patients and their close contacts are. We made it more convenient for safe entry, more languages, particularly for migrant workers, because that's where many of the cases were at the time. And the most recent updates, we made some improvements so that it works a little bit better on Apple phones, as well as to allow more modes of safe entry QR. So there's many, every single month, couple of weeks, we have been trying to improve the app, make it better. But beyond that, actually, and you've seen the uploads, the download numbers. Now it stands very quickly. It was at 1 million just in the first week. And now we're at 2.2 million downloads, about 40% of the population. Still quite far from the 70% that we think, or 80% that we think is necessary, but we're getting there. At the same time, there was open sourcing. So working with the international community and trying to see how industry can help and other developers can help us improve the product. And for digital inclusion, we know that not everyone has smartphones. So we introduced a token. We organized a teardown so that we can share with the community and they can understand how it works. And we started issuance just earlier this month. And this is not the end. You can certainly be assured that, as needs change, as we want to continue to improve the effectiveness of contact tracing, there'll be many more improvements to the Trace Together program in the coming months. And hopefully we can together address the COVID-19 issue. So just to summarize with 3 quick points, technology is an important enabler, but it does not replace the humans. Secondly, the tools we have developed, Trace Together and Safe Entry, they improve the speed and accuracy of contact tracing. And actually, it's also sort of insurance policy in that it allows us to be better prepared in the event of a surge in community cases. This is what Dr. Leong says, you cannot be behind the curve. But to do this, actually adoption is key. And lastly, we need to continually adapt and improve our solutions because that's how the virus and situation will evolve. Thank you.
Thanks so much, Chee Hau. This was a fantastic introduction to some of the thinking behind the tech. Your overview has given us some food for thought on digital tracking and tracing systems across the life cycle of data, really. So from the beginning, from collection to storage to governance, to analysis, and then even the destruction of that data. We've also shed some light on the rapid development and continuous iteration involved with digital solutions as they strive to meet user needs. Of course, the very complicating factor here is that we really have 2 very key stakeholders, public health, as well as individual citizens and businesses. And in a rapidly changing and complex environment, that's precisely why we need that iteration to meet those needs. Our third panelist is Professor Ang Peng Hwa from NTU. He teaches and researches on media and internet law and policy. He's a lawyer by training and he consults on data protection. And I'd like to invite him to share his thoughts, especially on the comms angle here. Professor Ang, please.
Hi, good evening. Glad to be here to talk about a really important issue. I think the issue that I'm addressing is one that's misunderstood. And so I have basically two major points. I think one, first of all, to clarify this issue of privacy and the misunderstanding involved. I guess for this group of participants, you would have seen the petition that went around. At least most of you would have. Asking people to sign up not to impose the Trace Together token on users. And I don't see that happening. I think the first misunderstanding is, what privacy involves. So let me just show you this slide. This is hot off the press just last week. It's from a conference that I was supposed to attend. It's in Finland. So if not for the COVID, I would have been enjoying the sun, 100 kilometers north of where the conference was held, or supposed to have been held, the sun is on 24 hours. And then further down, the sun goes down just a couple of hours in the day. So this is from a conference presentation talking about tracing apps and how they meet or do not meet privacy concerns. There are 11 countries portrayed here. Altogether, from what I gathered, I think yesterday, day before, there are about 25 countries in the world that are using some kind of tracing apps. There are 193 UN members, so what about 1/8 of the world having this tracing apps. So here in this slide, you see that green means that they meet the privacy concerns. There are 5 areas: technology design, data governance, data minimization and retention, voluntary use, transparency, and trust. There are 5 areas, and you can see that no country is green for all 5 areas. So the important point to note here is that privacy would involve a trade-off. I mean, if it's totally private, no one can reach you, no one can infect you, it's true, but it also means if you're somehow infected, no one will be able to reach you. So you don't want total privacy in this context, in this sense, right? You want some way to access people to access you, to reach you. So you will see that of the lot, right? India and China, the top right-hand corners, they are all orange, which means they do not meet the tracing apps, do not address the privacy concerns. Okay, Singapore, we are on the bottom. Australia is on the extreme right. We're next to Australia. We have 2 green areas. We are green for the technology design. And I think here we should commend really our GovTech people, Chee Hau, you should take a bow. You and your team should take a bow, because the idea was really outstanding. So much so that other countries, I think, began to ask them, even some kind of FAQ, I gather. And then people started basically copying the design, right? The word used is heavily inspired, right? Which basically means copy, right? So they copied the idea, and I guess some of the design as well. We can see where we kind of fall off, right? 2 areas: data governance, and part of it is that, where does it go? There's some uncertainty regarding that, right? And then data minimization, retention. Again, I've raised it before, talking about the NIRC, whether it's absolutely essential to have the NIRC or not. I think people are very nervous about that. Transparency and trust. I think trust, people can generally trust the government and government systems here, so that's not a major issue. But transparency, like I think the issue that I've raised before would be like, can you be prosecuted? Because I did my search before I wrote an article about this, and all the information that's out there seems to suggest, now it's not really clear one way or the other, whether it might be prosecuted or not. So I think there's some issue of transparency, but that's where we follow up. So you can see that we check 2 boxes. You look at all the other countries, you can see generally check 2 or 3 boxes. So in terms of checking boxes, we are not too bad, right? The one that's sort of outstanding maybe is Austria. This is in the European Union, the EU, and they have 4 out of 5 boxes checked. Okay, so that is good. But the important point here to note is that no country checks all the boxes of privacy, right? So you want some tracing apps, you have to give some kind of trade-off, some kind of compromise, and recognize that other countries are doing it also. Okay, the next slide, please, Marine. Okay, the next slide, this is my second point, right? The more we trace together, the safer we will be. Okay, this is the op-ed that I wrote, but I think it really is the case. It really, if you use more of you use it, the better. So all of you who are here participating, please, use it. It will help. So let me show you what this thing is about, how it works, right? So you would have read that we need to hit 75%. Chee Hau, now you're up to the 80%, right? I read that we could only 60% is enough, right? So this is from Oxford. I think here's where the global media has failed us, and I'm speaking as a media and communications professor, right? I think the global media has failed because they all harped on the 60%. They basically said that if you hit 60%, you are good, right? But if you don't hit it, then the question is like, then what, right? So let's take a look at the original report, right? So the original report, effective configuration of a digital contact tracing app, okay? And this is from Oxford. It says the epidemic can be suppressed. So infection is, as Dr. Leong mentioned, right, less than 1, okay, below 1, right? So the infection passing on is less and falling, right? The epidemic can be suppressed with 80% of all smartphone users using the app, okay, 80% of all smartphone users, or 56% of the population overall. So you just need 56% of the population. The reason you don't need 100% is that it's a statistical thing. It's like your mask. It's not 100% effective, but if everybody uses it, it is effective, right? So it's not, so it's kind of a statistical thing. The point to note is that we do not need to hit a high number. 56% of the population overall is enough. 80% of smartphones. Question, can we hit 80% of smartphones or not? Okay, so I asked around, and the app that has the highest penetration is WhatsApp. It is 84%, right? And I know that I think this group, everybody uses it. I was just contacted WhatsApp, right? Everybody uses it. So it would mean that just about everybody using that app. So I think it's unlikely we'll hit the 80% of smartphone users, but we hit 56% of the population overall. Now, here's where it's the media has failed us, right? So we don't hit 80, we don't hit 56%, or they round it up to 60%. We don't hit the number. What does it mean? Does it mean it's failed or not? Okay, and here's where the second part of the statement, right, which is where the media did not report, and I highlighted in yellow, right? So the comment from the professor, Christopher Fraser, I believe, said is that, what he said was this: our models show we can stop the epidemic if approximately 60%, okay, the precise number is 66%, approximately 60% of the population use the app. And okay, and this is the important point, even with lower numbers of app users, we can still estimate a reduction in the number of viruses, coronavirus cases, and deaths. Okay, so it means that even if you don't hit 56%, you hit less than that, it is still good. We will reduce the number of infections and deaths. Okay, and I can speak from sort of a personal experience. My daughter works in the restaurant, and a visitor to the restaurant, a patron, was infected, right? And it's sort of highlighted and contacted. And the wait staff who had served this person was tested. So we're all like, okay, what does it mean? You know. So when I don't know about you guys, but to me, the virus is so infectious. When I heard that report, my throat began to feel scratchy right away, right? It's then infectious, right? So it turned out to be negative, right? For the wait staff and for my daughter. Okay, so that's good, right? But imagine that if there had been no such tracing to be so specific, right? Who was the wait staff who served the person the most, right? At the time, right? If there's no such contact tracing, you would have to shut down maybe the whole restaurant, right? So we talk about economic impact. So you can see how contact tracing really helps the economy as well, right? So gives it more certainty, helps the economy as well. So looking back now on this, your original reports, basically, okay, Chee Hau, and you know, the numbers here are different from yours. Maybe for whatever reason, we don't need 80%. We need 80% smartphone users, but according to Oxford, 56% is enough. But here's the better news, right? Even if we don't hit 56%, the more we trace together, the better it is for everybody. Okay, so yeah, thank you.
Thanks, Professor Ang. I thought your remarks were really key in highlighting the fact that the social dimensions of tech systems, and not just their technical features, like whether they inspire trust, are really key in ensuring the success of these technologies. And ironically, you also pointed out, I think, that the efficacy of these systems can actually play a really important secondary role in helping to manage anxiety or panic that people might otherwise feel in an emergency situation like this. I guess we'd like now to move into the panel discussion, and we already have a handful of questions, I think, on this theme, right? And arguably, it's the most important theme, which is, does the technology work? Is it effective, right? So what difference does the tech make to our human contact tracing measures? How much quickly are we identifying potential infections? How much better are we at identifying clusters or forward infections? So either Professor Ang, Dr. Leong, or Chee Hau to start the ball rolling, please.
I think first is I wish to give the assurance that the technology works. I cited a figure of 70 to 80% adoption, but I think Prof Ang is absolutely right. Even at lower levels of adoption, the technology has been effective. But of course, the more we trace together, like he says, the better it will be. That's a very good ring. I give some examples of how it has worked. I think first of all, trace together and safe entry work as part of the whole system. Ultimately, the effectiveness is not measured in how their own individual outputs, but in the whole system. And when we look at the whole system, the time to isolation of MOH has come down generally from 2 to 3 days for most cases, down to less than a day. And I think that's, so just to give everyone the assurance that technology works. Now, what we want to do is also to prepare for in the event of a surge, because if there's a surge in cases, that's where we really need, it's very likely that our human contact tracers could be overwhelmed once there's too many, and whereas the technology is able to scale much better. I give some very specific examples of how it has worked. Firstly is that when we compared the close contacts that have been identified through Trace Together, there is almost 100% match with those that were identified by manual contact tracing. So we know that the technology is accurate. In fact, sometimes it's too accurate. So I gave maybe two stories. One is that we have found certain contacts that were not picked up by manual contact tracing. In some cases, we had to do interviews, and we found that it was because the two patients had met each other or came by each other at the NCID. So they were all both going testing, and then they happened to be nearby, but they didn't know it at the time. Another more interesting example was two neighbors in HDB who happened to be seated very near the walls both, and so their phones had picked it up. But again, they didn't know it, and of course there was no risk of infection. But again, this is something that shows that technology works. It can actually pick up people you may not even know about, or which the manual contact tracing process cannot identify, and that's accurate. Similarly, for safe entry, I think what it has done very effectively is to reduce the time taken for contact tracing interviews based on feedback from MOH, and I think there was a Straits Times article about this a couple of days ago, is that it has really speed up their process. Nowadays, when the contact tracer starts, actually they have a list of places that the patient has been to already pre-filled, and that saves them quite a bit of time. So maybe I hand over to either Dr. Leong or Prof Ang.
Dr. Leong, you go? I mean, I'm okay.
So I'm just going to chime in and say that I do feel that the contact tracing has improved in terms of the results and the people it plays to. And certainly I find a safe entry to be very helpful in jolting people's memory where they've been to. If the best thing to do is think where you've been to for the last 5 days. Chances are we'll forget. I can't. Think about it. If you do it 7 to 10 days, it's difficult. But once you have the safe entry thing, it helps to jolt the memory and help people build an idea, scaffolding of what we can do. And I want to see Trace Together more established in the whole Singapore, because at the end of the day, Singapore's economy has to move on. We have to do some form of safe, effective contact tracing so that the economy moves on with minimal risk to the rest of the people around. So besides masks, we need to have good contact tracing, good testing. Only then can we keep the virus down on its knees and we control it.
Okay, yeah. So I don't have any stories about successful contact tracing. I think Chee Hau, I'm glad you have that, and I really hope that some of these stories will go out and be reported so people know. So in my case, or in my daughter, but that's kind of a bit remote, so I don't have an instance I'm hearing it from really a third-hand source, right? I think those stories are important for people to know. I am really puzzled as to why people think privacy is so important that they wouldn't download this app, but they carry around a phone, right? So if you know how phones can be traced, okay, there's a movie by Will Smith acts called Enemy of the State, right? He's traced by the smartphone, right? Thank you, Dr. Leong, right? Okay, and just tell you the story. This is from somebody who told me, this is from China. He was driving somebody, this friend of a friend, so again, not firsthand, drove this person to some place where there was an infection. Next thing he knew, he got a call. Now this guy had been in a car. He was driving a car. He just got somebody off. He didn't get off the car. He talked to anybody, and then he drove off. He didn't make a phone call. But because he was there, the mobile towers could pick up the signal. They could tell he was there. The technology to trace you on your phone, unless you carry around some kind of walkie-talkie and not your mobile phone, you can be traced through the cell towers. And then you're worried about this Trace Together app, which can help you tell you whether you're infected or not. So it just completely puzzled to me. So I would say if you really are concerned about privacy, don't carry your phone, right? Maybe a smoke chimney, a pipe, whatever, send out smoke signals, a bird, a pigeon can send out message, but don't carry your phone because you can be traced.
Right. I wanted to sort of maybe push the panelists a little bit because we already have a question about this as well in the Q&A, which is, could alternative approaches to contact tracing also have worked, right? And one of the participants is asking about whether a decentralized approach might have worked. One of the things that comes to mind is the Apple and Google exposure notification protocol, of which there was some questions about recently. And so briefly for our participants, the Apple and Google EN protocol does not allow for the uploading, for the centralized uploading of data. It simply does a Bluetooth handshake, or I'm not sure if it's even a Bluetooth handshake, but it simply alerts users if they have been exposed, and then they take action to go and do that. And so there were some questions about whether that approach might have worked. I was wondering if any of the panelists had any thoughts about whether we could possibly make use of that kind of arrangement here in Singapore.
I could say something, and then maybe Chee Hau, we can chime in and ask you a question related to that. Yeah, I think it is possible. The concern though is that this Apple, I wrote something somewhere else on this point, right? The problem the Apple approach is that it's tied to your phone and maybe your number. So then the thing is that if you switch, then and this happens, for example, possibly for example the migrant workers, there's a high rate of churn because you use the prepaid phone, then you may not be able to trace them. So once you're not able to trace somebody and the person is infectious, then that's an issue. So I think that's where it kind of falls off. Apple and Google coming together, it's really a big milestone. So I was writing from the point of view of privacy, because Google's model is to breach privacy, basically. Well, okay, for want of a better word, but use data, and so in that way, minimize privacy protection. Okay, let's not use breach then, right? Whereas Apple's model is to have very secure privacy protection so that it can sell more phones. So different business models, right? The problem is that in a crisis like this, okay, I think that's where I showed up the first slide, right? I think you have to trade off some of your civil liberties, your rights. So if you really want to preserve, your privacy, so forth, like I said, right? Then you'll be hard to tell that you've been infected, because if you've been infected, we know you went someplace, right? We know your name, we got able to trace you, and that's how we are able to get you to the hospital quicker. So if you really want to be private, if you have to trade off, then yeah, sure, it's possible. Don't carry the phone, don't carry the trace together token. But if something happens to you, see you in hospital, right? So I think that's kind of an issue. I guess my question for Chee Hau is that I understand there's some technical difficulties with the Apple protocol. Maybe you can elaborate. I know that you, for example, you must run a foreground, and you're using now your Bluetooth low energy protocol as well. So maybe you can elaborate a bit about that as to why you couldn't use the Apple approach, and we have to use our approach. Yeah.
Thanks, Prof Ang. Happy to explain a little bit more. Well, when we first heard the news about Apple and Google, similarly, we were very shocked that the two companies are collaborating, but we were actually very excited, because one of the biggest challenges of that we face with Trace Together app is that on iPhones, Apple is very aggressive about killing apps or suspending them, as well as including Bluetooth connections. It means that once the app is no longer running the foreground, so let's say you're switched to check your email or you're surfing the web, and it's running in the background, actually it no longer able to detect other Trace Together users effectively. In fact, in most cases, the app gets suspended. So that is a big challenge, because in real life, nobody keeps the Trace Together app running on your phone all the time. Then you can't do anything else. So when Apple and Google announced their what they call exposure notification framework, we were very excited, because this will solve the #1 problem on Trace Together. And it's a technical problem that's very difficult to solve. I mean, only the smartphone these two big companies for Android and iOS can do that. But there are, I would say, three major shortcomings of the exposure notification framework that we, in the end, decided that we just simply could not accept. The first is about effectiveness of the contact tracing itself. So today, under Trace Together, if someone tests positive of COVID-19, MOH is able to tell from the data exactly who this patient A, has been in contact with, so persons 1, 2, 3, 4. Under the Apple Google system, actually MOH will not know that. What it does is that it broadcasts a list of infected patients, anonymized of course, to all the different phones, and the phones will do the matching on their end, which is why it's called decentralized, and then they will notify the server. So all we can tell is that there's a list of people who may have been in contact with some COVID patient, but we don't know which one. So that's a big challenge because I no longer can tell who might have infected who. I can't identify transmission chains. I can't identify clusters. And it really hamstrings MOH's ability to take action. So that's one. Secondly, compared to what we have a lot less control over the framework. Today we have done a lot of extensive calibration between different handset models about accuracy. But if you do the Apple Google framework, actually all of it is in the control of the two tech companies, including how often you're scanning around. And maybe it's trying to meet the needs of all the different countries around the world, but it could end up that it's suboptimal for Singapore's case. And that's something we want to avoid. Thirdly, I think very importantly is that there are many users, people in Singapore who still don't have smartphones or who choose not to have smartphones. But the crisis does not, the virus does not pick people based on whether they have a smartphone or not. We need to keep everyone safe. And that's why we have the Trace Together token. We have our own protocol that can interoperate with it. And with this, we are more confident of achieving a higher population coverage. So it's about trade-offs. If Apple and Google eventually make certain changes, I will not rule that out. But at this point, simply the trade-offs don't make sense for us.
Dr. Leong, I wanted to get your views on this because contact tracing is actually part of the management of many infectious diseases, whether it's Ebola or in the past smallpox or STD. So I was wondering whether, from your point of view as an infectious diseases specialist, a system like the one that Apple and Google have built, which does not allow for uploading of centralized uploading of data, does that work for you from a infectious diseases specialist point of view?
No, actually, I like it centralized. I like the fact that we can actually reach out from agency perspective to try to reach out to them. And then this is where I don't like it, honestly, that having the NRIC together with the Trace Together is safe entry. But if you think from it from an operation perspective, you have the NRIC, you know who the person is, you can track and can actually inform. Now, from an individual, I'm going to give up some of these civil liberties, like what Professor Ang said. I give this up so that I will know if I've been exposed. Because the data is very clear. If I've identified with COVID-19, I get treatment earlier, I'm going to do better than someone who is identified later. And once I've identified earlier, I can take steps to prevent the transmission to my other family members. So it cuts both ways. It helps the government in controlling. It helps me from spreading the rest of the infection to other people. And this, unfortunately, has to go in through a central agency for it to work effectively. So as much as Google and Apple is incredible, now we have an Apple and a Google thing, but I think it falls short of that ideal contact tracing circumstance.
Thanks. This idea that some sort of centralization of data is necessary from a public health point of view raises the question that several of our participants have asked, which has to do with the trade-off between privacy and security, right? So I think people would be much more willing to sacrifice some privacy if there are certain trade-offs or protections that we clearly identify. One, that the data has a limited lifespan. So Chee Hau has already explained that it's going to be deleted after 25 days. So that's great, right? But the other two things are, that the data has a definite purpose. So we are only going to use it for contact tracing. And Trace Together has made a public commitment to that. But the third is that the data is secure. And given that Singapore has seen some pretty serious breaches of data leaks in the health sector in the past maybe 2 years or so, right? Are you guys comfortable with the level of security that we're offering in the healthcare sector, or what assurances can we give Singaporeans that the data that they give up through Safe Entry and Trace Together is in fact secure? Maybe that's for Chee Hau.
Okay, I guess I have to give the answer. This is something we take very seriously. I would say it keeps many of us up at night. You know, we worry about this maybe more than many others. But I think I want to give the assurance that we have a framework in place, right? Last year, there was a convening of the Public Sector Data Security Review Committee. They had published their findings. You know, we are in the process. We have implemented all the baseline and basic safeguards. And even ahead of that, before that, we already had legislation in the Public Sector Governance Act. We had government instruction manuals, our IMs, that covers data protection among many others of protections around resiliency, security, and cybersecurity, and so on. So I think, first of all, there is a certain, both a legislative framework, internal rules, as well as technical safeguards framework in place. So when it came to COVID-19 and the kind of solutions that we're not starting from scratch. The kind of data that you're looking at, let's say for NRIC mobile numbers, these are things that we know we have established processes and technical safeguards in place, like encryption, you know, access control, ensuring that only the right parties are allowed to access it, every single access is logged, so on and so forth. So whether it's protection against outsider threats, insider threats, they are in place. So this is something, assurance I want to give sort of everyone. But of course, it's not stagnant. And when it comes to data protection and cybersecurity, this is something that we're constantly looking at better ways to improve. I think maybe sort of to give the context is that, another context is that, must remember we have only been in this for about less than half a year. Trace Together was launched just about 4 months ago. We are constantly improving the app. We are also constantly improving the data protection and security. These are not sexy stuff that I can show you as features on the time chart, but these are things that we're doing in the background.
Yeah, I think I can speak with a little bit of authority on this because my wife works in the healthcare sector and she tells me it can be a pain in the neck sometimes to work. I think those of you here would know to even use normal work. So I think the security level is pretty high. I know there's never 100% once you have some kind of link there, but I know they're trying hard there. So I think that's one. And then I have a little startup in the AI space, and I tell it's a pain in the neck for some of these government agencies now because we were caught in between. The project was almost agreed, and then this data breach, and then everything got suspended. I think everything got suspended for some time, in fact, for a period. So it was pretty rough. So I think a lot more care now about the data breach. It can happen. It's also partly my concern, but I think you kind of do the best you can, and then you know have some backup plan. But yeah, that's all you can do, given the need to have some kind of method of access, you know, to names. Yeah.
So how would you assess the government's engagement of the public on both Trace Together and Safe Entry, given the fact that the adoption rates are not where they ideally are? Like what could they have done better, or what could the government do better going forward to encourage adoption rates?
Okay, maybe I should go first because I stressed some things, especially critical work for Chee Hau and company, right? So I think it's a tough call because the first version, right, of Trace Together really drained the battery, and we admit that. I think I tested it, put it on bedside, and it drained about 60% of the power in just overnight, right? So about 8 hours thereabouts. So that's not kind of sustainable. But then the thing is that if you don't do that, don't try that, then do you wait to have a really good version? I think in a tech space, they call it MVP, right? Minimal viable product. So it's viable, right? It's just that it drains the battery. Isn't it better to have something that drains the battery but it can detect, as opposed to not have it at all, right? So that's kind of I think I can imagine the kind of the discussion going on there. But I think that was one. And then I thought that the safe entry was intrusive and in a way unnecessary if you have the Trace Together app. I mean, maybe we can elaborate on that, but the Trace Together, you know who you're in touch with, and then if you have who you contact with, so if you know that you know this person, that you can identify the chain of transmission. Whereas your safe entry, and I remember going to Paragon, and then like at the main door you got to do the safe entry, and then in the shop you got to do it again. I'm like, why did it? And so it became really painful to go through. You know, if you're going sightseeing, especially, right? Like, okay, going seeing place shops, then every single shop you need to do it. And then at the time I was like, okay, you have to enter my NRC, okay, S and 7-digit alphabet, and then my mobile number. You know, so it was a bit of a bear. And I was wondering why they weren't paired together, right? Meaning that Trace Together and which is now Trace Together and the safe entry, like you have this, and please be reminded to turn on your Trace Together, for example, right? So I think that's you know, that could have been done to get better adoption. And I think it's happening now. I suspect it's happening now because people can see. I think the sort of utility of it saves you some hassle, yeah, of having to enter the numbers. And I think one more would be the success stories. We don't hear enough success stories, at least in my area in communication research. When you try to get people to do things, advertising, in journalism, persuasion, and so forth, you need some success stories. I think we're hearing some, but you know, the ideal case is, okay, I had this Trace Together app, I used it, my friend didn't use it, you know, she got it later than me, she got noticed later, and then she became sick of it. I had this thing, and you know, I used it, and so my symptoms were mounted, for example, right? So some kind of success stories would be nice. People remember such stories that, okay, yeah, that could happen to me, they can identify with it, and then they're more likely to use it. So I think that's something that could have been done better. I know that, you know, there's always this hindsight, but I'm not sure how maybe comment on some of these issues, especially, you know, marrying Trace Together with safe entry.
Maybe we should let Dr. Leong say first, because this is supposed to be comments on the government's effectiveness. Yeah.
I think the government's really trying very hard, but we're not getting there. And I'm going to be very frank. If you look at South Korea, you look at how Taiwan did it, they had no, respect for privacy. In fact, if your handphone was in the vicinity of someone who's positive, you will get an SMS alert. Please get yourself tested. And that's how they control the outbreak, where one South Korean man in the night of fantasy and party transmitted to 119 people. That's amazing transfer, but they caught it all very quickly because they were able to make use of geolocation to do it. Now, I'm very sure Singapore has the technology, and now you can see in the question and answers, why don't we use it? But I think Singapore is really trying very hard not to actually activate this geolocation by people where we have, and they are expecting the individual privacy. Literally, it is like how I treat my son. Son, please study. Okay, then at the end of the day, if the son doesn't study, this is your own fault, this is your own doing, that because of that, your grades are not going to be good and you end up with an infection, etc., blah, blah, blah. So it is an individual, we end up taking our own individual responsibility and play our part for the country in that sense. I wish we could make it compulsory from an infectious disease point of view. That would make my job much easier, and then I would have to stop giving talks to the public. That would make my life easy.
But that's actually a really interesting point, right? Maybe a few weeks ago, there were some people who actually did ask for Trace Together to be made compulsory. And I completely agree that there's a public health angle here, but it's more than just a public health angle, right? So I was wondering what you gentlemen felt about those suggestions that Trace Together actually be made compulsory. Should it?
I would agree. And if you look at some of the questions out in the question and answer, people are saying, let's do it. Let's get Singapore going. Again, and let's be very honest. I'm not going to help I'm apolitical for the record. The opposition party actually look at the source code, which is freely available, and say, hey, there is no activity tracker. It is not activity tracker. It is a Bluetooth handshaker. That's all. Bluetooth and Bluetooth handshake. That's all they do. The opposition actually looked at the source code and say, hey, there's no location tracking.
So it is also why I put out the first slide talking about the trade-off, right? So if you look at the 5 areas of privacy concerns, so even in this time of COVID, people are still concerned about the privacy. The issue is how much you trade off. So one of the boxes is whether it's mandatory or not. So being voluntary would be a negative for privacy. I'm going to see, I think, okay, no, I don't have Taiwan and Korea on this, so I can't really tell to what extent they were violating the privacy there. But you can see that there are concerns. And I think that because we see ourselves as a global city, right, we want people to come from all over the world, people are comfortable. So I think that having mandatory is not a good idea. But I think that we can put a lot of social pressure for people to use it. And like, just like safe entry is now you have to use it or else you can't shop there. You could do the same with Trace Together, right? You show me the Trace Together app before you can enter my shop. So I think people can do that.
Maybe let me jump in here and just address sort of the earlier first question, Bernie's question about communications. I think that there are certainly ways that we can do better. You know, when it comes to communications, there's no such thing as over communication. You just got to keep saying over and over again. The messages got to be really simple and sharp and also relevant to the audience. And that's something that we are trying to do better at. I mean, a forum like this is one example with this audience, but it has to be at scale, you know, to so many different people, so many different groups, whether it's languages, contexts. That's something that we're trying to get better at. I think success stories will be particularly important because for some people relate well to facts and technology. They like to look at the more geeky stuff, but there are also a lot of people who want to understand the human aspects of it. Actually, what is the life like in the day of a contact tracer? How difficult it is? And I think maybe if we can sort of put ourselves in the shoes of someone who has to like really make so many phone calls every day, deal with, you know, difficult situations, I think we can better understand that. When it comes to whether to make Trace Together compulsory, I think our position right now and our hope is that we want Singapore to do this together. I mean, the whole SG Together is something we believe very strongly in. We call it community-driven contact tracing for a reason. The use of technology must be such that the people are with us, right? It's user centricity. If for a reason there's a need to force the population to use it, I think the question that all of us, you know, whether it's as individuals or maybe if you put yourself in the shoes of the government, should ask, will the people be with you or will they go against you? And I think once they go against you, it's unlikely the technology will work. So that's a very important consideration. Right? Can we keep the people together? I will also maybe talk very briefly about some of the trade-offs. I think explaining trade-offs is usually one of the most difficult parts to do. There's been, in the Q&A, there's examples cited about telco data. I think Korea as an example. Telco data inherently is accurate only up to the nearest about 100 meters to 500 meters. And it doesn't do 3D, so it's, you know, there's no vertical height. The kind of accuracy that it gives you, imagine if anybody uses telco data in a very dense built up area like Singapore, you will have to pretty much isolate or intervene with many, many people. Is that something we want, right? Is it going to be precise enough? Out of the hundreds of people that you try to quarantine, how many will actually have a close chance of getting infected? And remember, our definition is less than 2 meters, 30 minutes. So we believe that Bluetooth tracing, which can achieve that kind of accuracy, is the better way to go. And even for locations premises, we're being very careful to choose to balance the kind of premises where I think there is a certain risk involved in transmission. So if you look at, say, gyms, you know, if you look at restaurants, workplaces, these are where there's some research shown that there's a certain risk involved. You are there for a long time in confined spaces together. So we have done that. And also sort of layer on the practicality of checking in. There are certain places, maybe I think from a public health perspective, we will wish people would check in, but the kind of inconvenience it causes relative to the benefits that it provides the contact tracers, that's why we have chosen the list actually very carefully. It's something that was debated extensively within government down to like which category to choose. So some of these trade-offs, unfortunately, we may not have probably communicated, we have not made public, but I think perhaps over the next few months, it'll be useful to explain these a bit more to everyone.
Chee Hau, we actually have some questions in the chat about why we have both traced together.
Sorry, Bernie, can I just make a quick comment here about?
Yeah, sure.
So just to be clear, right? No, it is possible to over communicate. Actually, Chee Hau, it is possible, and it's called the boomerang effect. And if you over communicate, what happens? People do the opposite. This is found by my colleague using a SARS, and they found if you tell people to take care and so forth, they actually do the opposite. I observed it with the haze. You tell people to wear a mask and all that. When you tell them too many times, they feel that you're nagging them, and they do the opposite. So it's actually, there's certain art and science to this. So there's a whole different thing there. Yeah, okay, just my 2 cents there.
Prof, I will stand advice. You are the expert.
Indeed. Chee Hau, there are some questions in the chat about why we have both trace together and safe entry. So can you explain why we decided to develop both systems and how do they actually work together in the contact tracing process?
Very good questions. Trace together, if I recap, tells you who you have been near, but it doesn't tell you where you are. Safe entry tells you where you've been, but it doesn't tell you where you've been near. So both are actually complementary. I think when it comes to identifying people to isolate, to quarantine, the first order question is who has been near you. And so that's what Trace Together does. But in order for us to, for MOH to accurately identify transmission chains, how did transmissions occur, where are possible clusters, actually safe entry is going to be important. And there's also a certain, I guess, threshold that we want to look at. So if the research shows subsequently, or the medical evidence shows that in certain confined spaces, even if you're more than 2 meters apart, as long as you're in the same premise together for a certain extended period of time, it's safer to self-isolate or to quarantine. I think safe entry will complement Trace Together very well.
We have about 15 minutes left. Perhaps I could start asking perhaps the forward-looking questions to begin with before we end up with some thoughts shared before we end up with your last thoughts on this issue. I guess the first is what are your thoughts on international travel, given that Singaporeans are people who like to travel, that various countries have differing methods of contact tracing, if at all. What do we need to be in place, or how can we use technology to facilitate cross-border travel?
May I just chime in first then? I need my travel. I'm really looking forward to traveling, but I think it's going to be really difficult. So if you want to do travel in another country, the other country will probably have a low level of infection before we can accept it. Number two, I think we can start accepting people to come over to Singapore, and we can do it very safely if we have a very good Trace Together app uptake. That way, now let's put it frankly, when you wear a mask and you wear it correctly, you are actually very, very good in preventing transmissions. But together with a Trace Together app, we can almost have it like an almost waterproof effect, almost. So that's important. If you want to open up travel, then the people who come over to us are low risk because the country is not transmitting. They wear a mask and they maintain the same mask culture. And thirdly, they join in with a Trace Together app, which everybody in Singapore does it as well. Together with a check-in PCR and a check-out PCR, we would have a near faultless approach to travel. In fact, this could become the gold standard method in which we can open up for business travel to come in and out and reinvigorate the soul of Singapore and reinvigorate some of us when we go out for travel. So that's my 2 cents comment.
I'll maybe just add on. I think, in thinking ahead, when we design the Trace Together token, I think one possibility is also with travelers in mind. Not every traveler will be comfortable or want to download an app, or they may not even have a smartphone. So just to make sure that we are able to protect sort of the population, token could be one possible complement. I think Dr. Leong probably has listed most of the elements in place. I would say that on the government's end, you have heard some of the news about reciprocal green lane and essential business travel with other countries. So there's a lot of active negotiation and discussions going on. I think on the public health end, I mean, the medical professionals will know also there will have to be a process of, say, certifying the test results of other countries, whether it's accurate, you know, because not everybody, it may not be practical to swab everybody when they come into Singapore. So some of these discussions are really ongoing. There is the science element, there is the sort of diplomatic discussions, and of course, technology, we believe, can also play a big role. Yeah.
So I think that at this stage, I agree with Dr. Leong that if you're going to travel, you really need to take your special precaution. So just to give an anecdote. So from my home to the Kopitiam, about 1 kilometer away, I use the Trace Together app. On some days, I can get 0 exchanges, going there and coming back, right? But when I go to town, to Orchard for a dinner, I'm picking like 200, 300 people, you know, around me. Like, where do I meet 200 people? Like, you know, I just go to the restaurant and then I'm car park and home. That's all, right? So I think that the people in town seem to be a little more aware and are taking more precautions. So I'm a bit concerned that our heartlanders, feeling that, oh, I don't go to town, you know, just this neighborhood, and Singapore is low community transmission anyway, we are actually complacent and not taking as much care. So I think that there's something to note. I think the travel part of it will be challenging. I think that those who travel will be you know, taking extra precautions. So I think that actually it might be not so bad. It probably, of course, statistically speaking, I agree, Dr. Leong, probably you go to a place where it's sort of safe. But I think the people will take care. I think it might work. You know, given the precaution that people who travel are taking right now.
Just to push the bounds of thinking a little bit more further into the future, right? At what level of confidence would you be comfortable with removing contact tracing tech and deleting the data collected? So for example, would we have to return to doors gone green? Would we, when we achieve herd immunity with a vaccine, what's the yardstick by which you'd be comfortable removing the tech?
I think number one is we need to have good treatment for it. We have a drug called remdesivir. I'll be very honest, we say that's not good enough. We have a steroid to use, that's still not good enough. We have plasma available, but that's expensive. We're going to have other options. So when we have a good treatment and a good prevention with good vaccines, I think we can remove it. What's the timeline? I think we're talking about 1 year, 1.5 years from now, fingers crossed. Yeah.
Prof Ang, did you have or Chee Hau, do you have anything to say about your comfort levels?
Maybe just to say that my job is not about comfort levels. My job is to prepare to make sure that we are ready.
Okay.
Yeah, I guess we'll take advice from experts like Dr. Leong and company, those who can say at what level it is safe, you know, so that the community transmission basically is almost practically nil, basically. Yeah.
Okay. All right. So gentlemen, we have 10 minutes left. I wanted to have some time at the end of the webinar for you to share your last pieces of insight or wisdom on this topic. And so perhaps Dr. Leong, you can go first.
Okay, I'm actually quite intrigued with the questions that come forward. In fact, I do find that many people seem to accept this Bluetooth tracking idea. And from the questions, I do feel that many people are willing to give up these civil liberties to help support the movement, which is to actually control the virus. So it is, number one, very encouraging. Number two, I like the questions that are coming up because people are showing a lot of interest in the COVID-19. And there's greater awareness. And indeed, I would like all Singaporeans, more Singaporeans, my kids especially, to ask more questions and not take everything as what it is, but ask questions about it. This is very encouraging. Now, my third thing which I want to say is actually directed to my own panelist, Mr. Tan himself. You see, I honestly found it a chore to do a smart the safe entry check-in. Every time I go in, I have to use my SingPass to do it. I thought of an idea. If every entry of each shop has a Bluetooth device, okay, and it will beep every time a machine comes near to it as it registers it. So all I need to do is to have my Trace Together app. As I go past it, it goes beep. It has registered me. I've gone in. It knows that I'm there, and I've been tracked to know that I've been to the shop, and I carry on. So I don't literally have to do a safe entry check-in anymore. I do a Bluetooth, swaying my hips down the road, and I'm in. Okay, so that's my end of my, I'll pass it to Mr. Tan to answer that.
No, thanks very much, Dr. Leong. I'm very happy. Not just sort of yours, this, I don't see, it's not a well idea at all. I can sort of maybe just can't say too much, but give you the assurance that we are actively thinking about it. We have to make sure that technology works and that the adoption is there. And actually, there's been quite a couple of other suggestions in the Q&A that I think are very good. For example, if the technology works so well, should we not automatically issue quarantine orders once we know who they are? You know, MOH has been publishing locations that some of the COVID patients have been to, as well as the date and time. Given we have safe entry, can we not notify some of them? So I think these are things that we are very actively thinking about. I mean, good that we have more suggestions, but perhaps in the coming few weeks and months, I hope to be able to bring you better news about what's coming. If I can just end off perhaps on 2 points. One is that I think in terms of communication, really the government is going to have to try to do better. It's not just about us explaining, it's about sharing sort of our knowledge, explaining the challenges and the trade-offs. I mean, people don't just want to hear the good things, they want to hear the difficult stuff. I think if we can be a bit more open about that, and that's what we want to do, collectively, the community can help to spread and explain to others, and that's important. And the last point is, you know, I'm just going to borrow from Prof Ang, the more we trace together, the better it will be. So I hope that more of us will use the app to encourage our family and friends to use the app. When we launched the app, we use this tagline at the media briefing, which is that trace together is to protect first yourself. Secondly, is to protect your loved ones because they'll be notified. And thirdly, when everyone does it, it protects the community. So this is where maybe I'll end off.
Okay, I guess I just have maybe one major point. Well, maybe two. Okay, I think the first one is to avoid. I think it's Chee Hau actually. He kind of reminded me to watch this point of over communicating, because people feel that they're nagging them, then they do the opposite, right? But I think that we should promote this use in your typical social media influencer kind of style by showing it. And I think that, for example, the Trace Together token, I'm a bit concerned that the Trace Together token is identified with the less technologically savvy. So you're seen with it, that means you are not able to, you don't have a smartphone, or you cannot use it, you don't know how to use it. And I'm kind of concerned about the negative imaging. So my suggestion is that our ministers should carry a prominently colored Trace Together token. It should be bright pink. Okay, all the ministers should carry, but only the ministers can carry it. Okay, we make exception of Pritam Singh because he's now an official opposition leader, so he's okay. The rest of them cannot, but only those people, bright pink, okay, and you carry. And I think it will confer some prestige element. So to say that, look, I've got this thing which the ministers also carry, right? So, and then hopefully that can tell people that, well, if the minister carries it, then it's okay to use it. So some way to promote the use of this without
with the Singapore flag and the logo and everything.
Whatever you want, right?
Great, thanks to Dr. Leong, to Chee Hau, to Professor Ang for your comments and your insights for this evening's webinar. I just wanted to say Bluetooth beacons are indeed tried and tested technology, and we already use them in a variety of workplace settings. And our phones do come with Bluetooth transmitters and receivers built in, so it's not too far-fetched an idea that Dr. Leong has. But yes, thank you to everyone for joining us this evening, to our panelists, to our viewers. I've learned a lot about the resources we have at hand to fight COVID-19, not just the tech, but also, you know, the medical and public health measures, but also crucially, this deep reservoir of public trust that we have in Singapore that we want to use and we want to build on, that we don't take for granted at all. Just a note for from an organization point of view, we will be sending you a survey to gather some feedback for the event. Please do share your comments on tonight's webinar on how we can improve, what you liked, and so on and so forth. And lastly, for more webinars in the Smart Nation in Conversation series, please do check into our Facebook page for more information. So thank you, everyone, and have a good evening.